Chronic complications of diabetes. A nursing priority is to focus interventions on modifiable risk factors. Assess the learning needs of all diabetic patients. Please look at assessing the learning needs of the diabetic patient in Table 64-14. The macrovascular complications, think about large blood vessels, include reduced immunity, cardiovascular disease, which can be reduced with aggressive management of diabetes, hypertension, and hyperlipidemia. Cardiovascular disease. The risk of stroke is 2 to 4 times greater in those with diabetes. And it can also be microvascular complications. This time think small blood vessels. Eye and vision complications are diabetic retinopathy. They can also have renal disease, diabetic neuropathy, sexual dysfunction, and cognitive changes. Preventions of complications of macular vascular problems. We want to try to keep that blood pressure less than 140/80, with a target of 130/80 in the young. Again, this has changed. You really want to get that target of 130/80 in all people at this point. We want to control that cholesterol level. We want to keep them on a diet that's low in saturated fats, trans fats, and cholesterol. We want to increase their fatty acids, fiber, and plant-based foods. We want to focus on weight loss and increasing physical activity. We want to try to smoking cessation, medication compliance, and regular follow-up. Now, for a patient who perhaps is 55 years of age, you're not going to do all this in one visit at a provider's office. This patient who has been diagnosed with type 2 diabetes has been living this lifestyle for quite a while, and you're not going to be able to change everything at once. So we have to be able to approach this slowly. We want to give them their risk factors. Some people will go, Johnny on the spot and go on this extreme weight loss diet. They'll increase their physical activity. They'll stop smoking. They'll follow their medications to the letter of the law. Others will become rebellious and pretty much ignore it. But most people are somewhere in between, where they're really trying to do well, but it's a hard lifestyle change for them to make. And they don't, and then when they backslide, they feel like they're a failure, and so they have more trouble getting back on the road to preventing these complications. So we have to be patient with our type 2 diabetics. We have to tell them what the risk factors are and things that we can do to prevent these complications. But we also have to meet them where they are and continue to work with them to change their diet, lose the weight, increase their physical activity, stop smoking, and do the medication compliance and make sure they have regular follow-ups. A lot of times you can get them to do the medication compliance and regular follow-ups and then go, start walking just a little bit, and then tomorrow walk a little bit further. And you'll be surprised, start with, instead of getting the Big Mac, go for a smaller burger, and then talk about eating fish. You have to if they try to make this, it's overwhelming and they can't make all of those changes all at one time. I hope that makes sense. Microvascular complications. We talked about blindness being 25 times higher in those with diabetes, including diabetic retinopathy. People with diabetes also have peripheral neuropathy. Patients can get cataracts at a much younger age, and they develop much faster. They'll have cardiovascular autonomic neuropathy. Again, they'll have the diabetic neuropathy. They can have GI problems. they can have erectile dysfunction. And greater than age 65, they have an increased chance of having dementia. Nursing focus on prevention education. We want to talk to our patients with diabetes about getting routine eye exams. We also want to talk to them about making sure they're controlling their hypertension, along with blood glucose management. We want to talk to them about their blood lipid control. And if they do have high blood pressure, see if they're on an ACE or an ARB to help protect the kidneys while controlling their hypertension. Now, remember, some people can't tolerate some of those blood pressure medications because of the hacky cough. But if they can, it will protect their kidneys and along with lowering their blood pressure. Patients, especially with type 2 diabetes, we need to do a depression screening. And both type 1 and type 2 diabetics need to make sure their eye exam is done with an ophthalmologist. In case you're not familiar with that, an ophthalmologist is a medical physician. A optometrist is not. They have different credentialing, but they have not gone through the same type of medical school. It's more focused just on the eye. So you want to make sure that someone who has these risk factors with their diabetes, that their eye exams are being done by an ophthalmologist, so that they are getting more screenings done and more treatment options are available. Now, we've talked about that there's two main types of diabetes. There's the type 1 diabetes. That's the autoimmune disease usually seen in younger patients. These people require a basal insulin at all times. Then there is the patients who have type 2 diabetes. This is a progressive metabolic disorder in which a person's body still can produce insulin, but it's unable to use it effectively. A lot of times these patients have a combination of insulin resistance and decreased secretion of insulin. So those are the two main types of diabetes. But then there's a metabolic syndrome, which is the presence of risk factors known to increase their risk for type 2 diabetes and cardiovascular disease. It's abdominal obesity, hyperglycemia, hypertension, hyperlipidemia. Mainly just look on that table 64-5. But the two types of diabetes is type 1 diabetes is an autoimmune disease. It's usually seen in the young. They need a basal insulin at all times. Okay. A type 2 diabetic, it's a progressive metabolic disorder. A lot of times these patients can still make their own insulin, but it is unable to be used effectively with a combination of increased resistance and decreased secretion. Prediabetes. Now, prediabetes, again, if we remember, is about 86 million Americans. A lot of times these patients are at a 15-fold risk of developing type 2 diabetes. This is associated with obesity, especially around the abdominal area, hyperlipidemia, including high triglycerides and low HDLs, and these patients usually have hypertension and lead a sedentary lifestyle. Again, these patients are 5 to 15-fold higher risk of developing type 2 diabetes. I'm going to stop this recording here so that we can start up fresh with the assessment of the diabetic patient.